Right, thanks so much, Danny. All right, we're continuing breast cancer awareness and talking about that this month. We have nurse practitioner Ashton Ferrell with us from Baptist Health. Thanks so much for joining us and letting us ask you all kinds of questions this morning.
Well, I think the first question is for people at home, when it comes to breast cancer, what are the signs and symptoms to look out for?
So one of the signs you hear about the most is if you find a hard, immovable mass in your breast that you need to go get it checked out. Absolutely. Some of the other signs that we don't hear about quite as much is if you have skin changes, including redness in a specific area, thickening of the skin, or dimpling of your skin, new nipple inversion or discharge, and then swelling of your lymph nodes around your armpit area.
What is the age that you usually go and get, that normal yearly checkup?
So usually that starts about 40 if you don't have any personal history or family risk factors.
Gotcha. And if you do, then you should probably talk to your doctor and do that maybe sooner.
Absolutely, yes. If you have a extensive family history of breast cancer, then there's a lot of different options you need to talk to your doctor about, including genetic testing, earlier screening, and potential preventative treatments based on your risk factors.
Absolutely. I think, and one of the main things is, it can be scary to think, okay, if I go, what if they say, something is wrong? And we just shouldn't let that hold us back.
Absolutely, because the earlier you get treatment, get intervention, the better your outcomes are, the better your overall life is, quality of life is with early treatment and intervention.
Well, and I think one of the things that scares a lot of women is if they do find out they have breast cancer, the surgery, right, getting their breast removed. But I think a really neat thing that the state is trying to do right now is they're finding new ways for insurance to help with those reconstructive surgeries. Will you talk about that a little bit?
Yeah, so they actually just passed Act 424 that'll go into effect in January, and now our state insurances will be required to cover reconstructive surgery. It covers a lot more extensive surgeries now. It could still require prior authorization, but overall it'll give women a lot more options.
That's Absolutely. Awesome. Hey, thank you so much, Ashton, for being here with us today. We're going to keep her with us at 7 o'clock coming up on 5 News this morning, plus to ask her many more questions. You don't want to miss that.